I always thought I'd go into medicine. My grandfather was a physician, my father's a physician. I always saw the enthusiasm with which my father went to work and still goes to work, and he loves it, and I do too. I think I'm very aware of how important sight is to everyone in terms of their experience in the world, their enjoyment of their life, and I'm amazed at the dignity with which people take things when their vision is lost or threatened, because I can only imagine how stressful and scary it must be to suddenly be faced with loss of vision in one or both eyes. And the operation takes about an hour, and after the surgery, again, your eye will be filled with that gas bubble, a bubble that your body will remove over about 3-4 weeks. Mr. Levesque has a hole in his macula. The macula is the center of the retina, and he's got a hole right in the middle. What that means is he can't see details. He has a big black spot in the center of his vision, and he can't read any fine details. He sees around the edges, but he can't see in the center. The interesting thing is, up until about 5-6 years ago, we didn't realize we could operate on these patients. It was thought that these holes happened because an actual round piece of tissue got pulled out and was missing. In actual fact, it's been discovered that there's no tissue missing. There's been traction pulling sort of along the plane of the retina, sort of pulled out, sort of like opening up a buttonhole. So we do the operation where we go in, peel off the scar tissue that's causing that pulling. Those edges reoppose themselves, and the hole literally disappears, and their central vision can come back. So no, this is fine, Marianne. Yeah, that's great. This is green dye, which we're injecting into the eye to stain whatever membrane might still be there that's not visible to the naked eye. When there is something to stain, it stains it remarkably quickly. See where it's stained green all the way around the hole? Nowhere else did it stain it, because there's this growth of this tissue all the way around the hole pulling on it. With this blade, I'm making a little barb, and that's what I will use to peel off the scar tissue that's causing that pulling. You okay, Mr. Levesque?
Yeah.
Everything's great?
Yeah.
Just peeling off this membrane, but it's going very well. Can I have the forceps, please? I can't even begin to estimate how thin this is. It's I don't know, a hundredth or a thousandth of a millimeter thick, this membrane. Yes, yes. There's a membrane right there peeling off more. One big, large sheet that just came off now. You can see all that green is off all around the hole. We've gone in a big circular fashion, and all the green membrane from around the hole is off. I'm going to still peel off some residual membrane, but we've got the bulk of it off. Yeah. Everything's going great. Yeah. Now we're just going to aspirate out all the fluid in the eye and replace it with a gas bubble. And we want that prolonged presence of gas to push and help seal the hole. It couldn't possibly look better. Everything's just like I would have hoped. I think probably the most touching cases that I deal with are the ones involving the little tiny premature babies. Babies that a few years ago didn't survive, suddenly, thankfully, are surviving, but it's bringing a whole new group of eye problems which never before did we see to this extent.
Well, he was born 4 months premature. We were pregnant with twins. It was identical twins, and his brother passed away a week before delivery. And after his brother passed away, I started having contractions, and Darrelle was delivered. He was born at 23 weeks and 5 days gestation.
ROP stands for retinopathy of prematurity, which is the abnormal blood vessel proliferation that happens in these very, very young infants.
So Dr. Devenyi said that he needed to have laser surgery, so we stayed at Sick Kids for a couple of days, and Darrelle had laser surgery to correct or just kind of help the blood vessels develop properly from that point forward.
If the blood vessel growth doesn't continue normally in these babies, they're blind, irrevocably, permanently blind. What I'm looking for, hoping to see, is that those abnormal blood vessels that were growing from the prematurity are drying up, and that the normal vessels are continuing to grow out to the periphery where they need to be. At this point, a week later, there won't be any dramatic, huge change. Sorry. One day he'll be 7 feet tall and come and beat me up.
You betcha.
As you know, this looks terrible, but it doesn't hurt. We know it doesn't hurt because we do it on adults all the time, and they would tell us if it hurts, without a doubt. It looks okay. Just gonna look in here. It looks like I would hope it would look so soon after. You know, those blood vessels, the abnormal blood vessels, which were the reason for the laser, are still there, but they're slowly drying up. The concern will be over the next many weeks, and time will tell, is that, yeah, it's great that they're drying up, but what sometimes happens is that as they dry up, that scar tissue starts to contract and start pulling on the retina. Most times it doesn't, but that's what we need to watch for, because if it does do that and starts pulling and elevating the retina, that's called a traction retinal detachment, and in that case, that's when we would need to do surgery. Fortunately, in most people, that doesn't happen. It's amazing, as tough as these problems are, it's a great feeling to be able to intervene and prevent blindness in these children. And I've been in practice now for about 13 years, so I see kids regularly who are now 12, 13 years old who can walk around and see. If we would have done nothing, would not have got to that stage. So it's very satisfying. I've been involved with the Leafs for probably about 3 or 4 years now, and it's shown me a completely different side of medicine. And these players are commodities, expensive commodities for the teams, and their health and welfare is also a commodity with which they have to be concerned. They could be criticized if a player is traded who has problems which weren't disclosed or diagnosed before. So it adds a very different and altogether additional dimension to medicine. Hold that there, please. What's the smallest line you can see?
6937428.
Good.
Bottom line.
Good. It's perfect. It's 20/10, which, remember, it is every year, and it's amazingly good. You know, I never, ever see patients in my office with 20/10 vision. Ever. 20/20 is the line above the orange. That's normal. 2015 is the line below it, and 20/10 is the 10th line.
Yeah, I can see it. I can barely see it, though.
Yeah, but what it means is that what a normal eye can see at 10 feet, you can see at 20 feet. Right? So that's amazing.
That last one is a 5, though, isn't it? Or is it an 8?
I don't have a clue.
Can't see that part.
Look straight ahead. In retinal surgery, we deal with all the major terrible injuries that occur in the eye. So it's a good fit for me to be involved with the Leafs and with sports injuries in general, because these are exactly the type of injuries that we deal with on a routine basis. Garry Valk got injured last year in a practice.
I noticed that it was just real bright on one side.
Take a seat down there. I just want to check your vision.
Well, I got obviously hit in the eye with a stick. It was my right eye. It was real scary at first. I could tell by the amount of blood that was on the ice and how small the cut was above my eye that most of the blood was coming out of the eye socket, which kind of scared me right away.
6'2", 6'4", 7'9",
Devenyi is the first doctor I saw. He was real good off the bat. He checked the pressure. He wasn't happy with the pressure right away, so we got some pictures of it. And after the operation was over, he was real happy. So it kind of gave me the self-confidence that the eyesight was going to come back. And I think that really helped in the recovery too.
Looks fine. I'd never know that you had an operation or that you had it injured. It's the end of that.
Perfect.
Okay, take care, Garry.
Yeah.
See ya. It's quite amazing that we don't see terrible eye injuries from hockey more often when players don't wear eye protection. In Canada, we've been keeping very careful statistics since the early 70s on all injuries in sports, particularly hockey. And the most compelling argument in favor of face protection in hockey are these statistics. When eye protection became compulsory in children's hockey in the mid to late 70s, we saw a precipitous drop in the eye injuries, and that's been maintained. The only injuries we ever see now are in people wearing no face protection, or rarely, but occasionally, in people wearing the half masks, but never with a full face mask. Makes all the sense in the world to wear eye protection. I play hockey every week, and I wouldn't dream of going on the ice without a cage. And certainly at the level that I play, it doesn't affect my performance anyway. Another very large group that we deal with are diabetic patients. Probably 40%, 50% of the patients that I deal with are diabetics. You know, the choice is, if it doesn't clear on its own, to do the surgery. Specifically, what diabetes does is it damages the blood vessels in the eye and the kidneys and elsewhere in the body too. Diabetics can get a destruction of the blood supply to the eye, and then when the eye feels it doesn't get enough blood, it forms new blood vessels which are fragile, they rip, and they bleed. Yeah, I can't see in at all. Lourdes has a stage of diabetic eye disease called proliferative diabetic retinopathy. So in an inadequate attempt to repair things, the eye releases chemicals that stimulate new blood vessel growth. And despite laser being used to try and stop the blood vessels from growing, it kept bleeding, the eye kept filling up with blood, and the body could not absorb it. I'll be able to show you in a sec on the ultrasound what that blood still looks like. It's really quite dense and thick. Look up and down. This white material here, that's the vitreous admixed with all that coagulated blood. And the retina lines the inner back wall of the eye. We don't really see it here because it's flat against the back wall here. It's good news that it's all in position. It's just that thick coagulum of blood that's in there, and that's what we'll just take out. And with a little bit of luck, if the retina's healthy behind it, which you have every reason to believe it is, your vision will be a whole lot better quickly. We train 3 vitreoretinal surgery fellows a year. It's a tremendous experience for both us who are here training them and for the fellows. These people have finished their training in ophthalmology. They're all qualified ophthalmologists, and they're here to do extra training in the specialty of vitreoretinal surgery.
Well, retinal surgery is a very high-tech and very delicate field, and without hands-on training, it's just impossible to get the skill level able to do private practice. So here, with Dr. Devenyi teaching me, it's been a good experience. I'm learning a lot.
They not only learn from us, but we learn from them because they bring a lot of experience and views from other parts of the world which we might not otherwise be aware of. How are you?
Obviously, I'm scared. The likely chance of anything happening is rare, but still, you know, somebody's going into your eye, cutting it open, you know, so hopefully everything works out.
How are you? Good. Get this over with? Won't be bad. You're an expert at this. So you know when we get in there, the anesthetist with the intravenous will make you drowsy. I'll give you freezing around your eye to numb it. After that, you should not feel anything. There are definite but small risks with any operation, and patients need to recognize that and accept that before any operation. That's the bad part. In the case of Lourdes, the decision's not difficult because she sees nothing out of the eye right now. In the surgery, we will cut out the vitreous. Vitreous is just basically jelly. We will replace the vitreous with just saline solution. We will also cauterize and remove all these abnormal blood vessels. So now we're just preparing everything for the vitrectomy. We've put in a little infusion line which will volume for volume replace the vitreous and the blood when we cut it out, and it'll replace it with just balanced salt. That's what's hanging in the bag. With gravity, it will just go into the eye and replace volume for volume what we cut out. This ring will hold various contact lenses, which allows us with the microscope to see farther inside the eye, because with just the regular microscope, you can only see the front of the eye, the cornea, the iris, the lens, but we need to see deeper into the vitreous and the retina, and these various lenses will allow us to see inside. I'm going to make some openings in the eye now through which we're going to put these different instruments under the microscope, which will illuminate the eye from within and allow us to remove the vitreous and the blood. Can we have the room lights off, please? It's full of white blood, the cavity of the eye. Blood, when it's fresh, is red, but it, over time, sometimes forms this dense white mass, as you can see. So we're just slowly cutting and sucking it out. You can see now gradually as we're starting to clear out this dense white blood, we're slowly starting to see the retina. No details yet, but you can see a little bit of an orangey glow behind the blood. Soon, hopefully, we'll see the retina clearly and we'll see the retinal blood vessels as well. They're slowly starting to get into view. And now we have a great view. We can see her retina everywhere. There's her optic nerve. Her retina is attached. All the blood is out. I've cut the vitreous out, and I'm going to cauterize those blood vessels now so they won't bleed again. And then we will add some laser to hopefully prevent these blood vessels from growing back. Okay, now the laser, please. 0.1 second. That's good. Let's just try that and see if it works. Is it ready? Yeah. Okay. Can you increase it to 300, please, milliwatts? Okay, that's good. So now we're adding laser to the periphery of the retina, because what the laser does is essentially we're selectively killing peripheral, not important for vision, not as important for vision retina, basically to fool the retina into thinking the blood supply is not as bad as it is. The idea behind this is if the retina doesn't feel it's as deficient in blood as it is, it won't release chemicals that cause the abnormal blood vessels to grow. We've taken out the blood vessels that were there. We've removed all the blood. The idea of this is to prevent future recurrences of blood vessel growth and bleeding. How much detailed vision comes back will depend on how healthy the retina is, specifically how good the blood supply still is as a result of the diabetes. Her vision was good before this bleeding happened several months ago, and when we look in, it looks pretty healthy in terms of the adequacy of the blood supply. So hopefully her vision will be very good after all this. Not uncommonly, though, that people can get a little bit of oozing of blood post-operatively, so it might take a few weeks, but I'm pretty sure she'll have a whole lot better vision by the morning.
How are you?
I'm good. How are you?
Did you have any pain at all?
A little bit of pain. Not actually pain, it's, ow, the eye's really itchy.
Looks very good. No sign of bleeding. Vitreous is clear.
Great.
It should still improve in the following weeks.
Wow, I can see.
So are you happy with what
I'm
you've
very
got?
happy.
Very
I can
happy,
actually
huh?
see. It's amazing.
I bet it's a big change from what you had before.
Oh,
right?
yeah.
Before surgery.
I couldn't see anything. Thank you.
It's a very positive experience to be involved in retinal surgery. The vast majority of cases can be successfully repaired and can be successfully repaired with one operation. We see eye injuries from crazy things that you'd never think could happen. We deal with blunt injuries, be they fists or other larger objects, which rupture the wall of the eye just by the sheer blunt force. We also deal with foreign bodies where pieces of metal or other foreign objects enter the eye. Good. Everything's okay. Your vision's a lot better than it was. Much better.
I was at work and a machine operator, and a piece of metal chipped off and went into my eye. I fell to the ground, and my friend says, "Let me see," and I removed my hands from my face, and he looked, and he says, "I can see the piece of metal." but he was actually looking at the hole that the metal had made.
Look straight ahead. It looks great. You've got that big hole in the back where that piece of metal went in, unavoidably. That's where the thing went in. You can see where the iris, the colored part of the eye, is actually sticking out of your eye onto the surface of the eye. Now with the vitrectomy cutter, we're taking out all the blood with which the cavity of the eye is filled and taking out the vitreous. We're working deeper. You can see how the cavity of the eye is filled with blood. Not surprisingly, since this piece of metal went through all these structures that have blood vessels in them. So that's why you couldn't see when the injury happened. The whole central cavity of your eye was filled with blood. And there's the piece of metal. There it is right there. That's the piece of metal embedded into the retina elsewhere. I'm going to put a little magnet in under the microscope, and you'll see the metal suddenly jump up. The magnet's picked it up. Now with another hand, I'm going to put a special diamond-tipped forceps in, which will grab it, and you'll see us taking this piece of metal out of your eye. There it is. Do you have it at home? I gave it to you, didn't I? Yeah. You can make some disgusting piece of jewelry with it or something. It's truly not like working. It's fun. It's fun to do it. Everyone deserves as much time as they need, and I don't want ever a patient to feel like they're imposing on me or that they're wasting my time or holding me up from going somewhere more important. Obviously, to every patient, whatever their eye problem happens to be the most important eye problem in the whole wide world, and I want them to feel that that's the case.